Welcome to today's video about symptoms of chronic inflammation. Scientists have identified a silent process called inflammaging, chronic low-grade inflammation that accelerates biological aging faster than time itself. Unlike the obvious inflammation from an injury or infection, this smolders quietly beneath the surface, often for years before you notice the damage. Research from leading institutions reveals that inflammaging doesn't announce itself with dramatic symptoms. Instead, it manifests through subtle, seemingly unrelated signs that most people dismiss as normal aging. The truth is different. These are warning signals your body is sending about inflammatory processes that are stealing your vitality and accelerating aging throughout multiple systems. Today, we're examining 12 research-backed symptoms that indicate chronic inflammation may be aging you faster than necessary. These aren't abstract concepts. They're real, identifiable changes backed by peer-reviewed studies. Understanding these signs gives you the power to recognize what's happening and potentially intervene before damage becomes irreversible. Your body is speaking. Let's learn its language. Now, let's go through the major signs of chronic inflammation, beginning with number 1, persistent fatigue. Deep exhaustion that persists despite adequate sleep signals more than tiredness. Research published in the Journal of Translational Medicine demonstrates that pro-inflammatory cytokines drive sickness behavior, including fatigue that lingers without clear cause. These molecular messengers, particularly interleukin-6 and tumor necrosis factor alpha, don't just fight infections. Studies from the Proceedings of the National Academy of Sciences show that elevated cytokines correlate with fatigue severity in chronic conditions. When inflammation becomes chronic, these molecules remain elevated, essentially convincing your brain you're fighting an ongoing illness. Research published in Frontiers in Immunology reveals that inflammatory cytokines affect dopamine function in brain regions controlling motivation and energy. This isn't psychological weakness or laziness. It's biochemistry hijacking your energy systems at the cellular level. When inflammatory markers stay elevated chronically, they create persistent tiredness that no amount of caffeine conquers. Unrelenting fatigue may be your body's first warning that inflammation is accelerating aging. Next, symptom 2, brain fog and slower recall. Cognitive sluggishness, forgotten names, and mental fog aren't inevitable aging. They're potential inflammation markers. A landmark neurology study tracking over 5,000 adults for 10 years found that elevated interleukin-6 in midlife predicted significant cognitive decline later. The combined effects over the decade corresponded to nearly 4 years of additional brain aging. Research published in multiple peer-reviewed journals confirms that inflammatory markers like C-reactive protein and IL-6 correlate with worse performance on memory, reasoning, and executive function tests. A study in the Journal of Gerontology found that participants with highest inflammatory markers levels performed nearly 2 points worse on cognitive assessments compared to those with lowest levels. These inflammatory molecules cross into your brain, disrupting neural connections and interfering with memory formation. Brain imaging studies show that higher systemic inflammation associates with greater brain atrophy and white matter damage. Your struggling memory might be inflammation attacking your brain's architecture.
Next, symptom 3, poor, unrefreshing sleep. Hours in bed yet feeling unrested signals a destructive inflammation sleep cycle. Research published in Frontiers in Neurology documents that sleep disturbance raises inflammatory markers, and elevated inflammation worsens sleep quality, a bidirectional feedback loop. Studies show that poor sleep increases C-reactive protein and interleukin-6 levels significantly. A comprehensive review in neuropsychopharmacology examining multiple cohort studies found that sleep disturbance independently predicts elevated inflammation even after controlling for other health factors. The relationship works both ways. Inflammatory cytokines disrupt normal sleep architecture, preventing deep, restorative sleep stages. Research in brain, behavior, and immunity, tracking thousands of adults, found that chronic sleep problems correlate with persistent inflammatory activation. These inflammatory molecules interfere with circadian rhythms, prolong time to fall asleep, and fragment sleep throughout the night. Unrefreshing sleep isn't just bad luck. It's inflammation sabotaging your body's essential restoration process. Next, symptom 4, bleeding or tender gums. Pink in the sink when brushing signals more than dental issues. Research published in Nature Reviews Immunology establishes that periodontitis sustains systemic inflammation, increasing risks for cardiovascular disease, stroke, diabetes, and cognitive decline. Bacteria from inflamed gums enter your bloodstream during everyday activities like chewing. Studies in Periodontology 2000 document that oral bacteria trigger inflammatory responses throughout the circulatory system, contributing to endothelial dysfunction and atherosclerotic plaque formation. A systematic review found significant associations between periodontal disease and elevated cardiometabolic risk. Research published in BMC Oral Health shows that treating periodontal disease reduces systemic inflammatory markers like C-reactive protein. The connection is so strong that scientists now consider periodontal disease a modifiable risk factor for multiple age-related conditions. Those bleeding gums aren't isolated. They're potentially fueling inflammatory aging throughout your entire system. Next, symptom 5. Achy, stiff joints, especially in the morning. Morning stiffness lasting over 30 minutes reveals low-grade inflammatory processes actively affecting your joints. Research in Nature Reviews Rheumatology demonstrates that osteoarthritis, once considered purely degenerative, is significantly driven by chronic inflammation. Studies published in Osteoarthritis and Cartilage found that 17% of hand osteoarthritis patients experienced prolonged morning stiffness exceeding 60 minutes. Research examining joint tissue documents elevated inflammatory cytokines, activated immune cells infiltrating joint spaces, and inflammatory molecules breaking down cartilage. This isn't passive wear, it's active inflammatory destruction. Studies show that the innate immune system, responding to damage-associated molecular patterns, creates cycles where inflammation causes tissue damage, triggering more inflammation. Clinical research published in Rheumatology confirms that morning joint stiffness correlates with inflammatory markers in blood. Chronic joint inflammation doesn't just cause discomfort, it accelerates degenerative aging of these vital structures, potentially limiting mobility for years. Next, symptom 6. Slow wound healing. Cuts lingering for weeks instead of days reveal inflammation aging your repair systems. Research published in Life Journal demonstrates that aged skin shows prolonged inflammatory phases during wound healing that actually delay repair. Studies document that aged wounds exhibit excessive, sustained activation of inflammatory pathways, with macrophages remaining inflammatory longer than necessary. Research in Cell Reports using single-cell sequencing reveals that aged skin wounds feature a more pronounced inflammatory phenotype with neutrophil persistence and higher abundance of inflammatory macrophage subsets compared to young wounds. The inflammatory response becomes poorly controlled, creating chronic wound-like conditions. Studies published in Advances in Wound Care show that this prolonged inflammation increases reactive oxygen species production and shifts healing toward protein degradation rather than synthesis. Wounds close more slowly, scars form with less strength, and chronic ulcer risk increases. Slow healing isn't inevitable, it's inflammation compromising your skin's repair capability. Next, symptom 7. Growing waistline despite stable weight. Tightening pants despite stable scale numbers signal dangerous visceral fat accumulation around internal organs.
Research in metabolism demonstrates that visceral adipose tissue actively secretes pro-inflammatory cytokines, free fatty acids, and hormones fueling systemic inflammation. This isn't passive fat storage. It's metabolically active tissue producing inflammatory substances. Studies in the Lancet Diabetes and Endocrinology establish that visceral adiposity strongly predicts cardiometabolic aging independent of total body weight. Research published in scientific reports shows that individuals with both high visceral fat and elevated inflammation have highest risk for hypertension, diabetes, and cardiovascular disease. This inflammatory fat depot releases molecules directly into portal circulation, feeding your liver, contributing to insulin resistance and metabolic dysfunction. Studies document that visceral fat accumulation associates with elevated inflammatory markers and accelerated cardiovascular aging. Your expanding waistline reflects invisible inflammatory processes, aging your metabolism from within. Next, symptom 8, duller skin and faster fine lines. Lost glow and deepening wrinkles reflect inflammation accelerating visible aging. Research published in Nature Reviews Immunology reveals that inflammatory signaling activates matrix metalloproteinases, enzymes breaking down collagen and elastin, the structural proteins maintaining skin firmness. Chronic inflammation keeps these destructive enzymes working overtime. Studies examining photoaging document that inflammatory molecules accelerate all skin aging hallmarks: increased oxidative stress, promoted cellular senescence, impaired barrier function, and reduced new collagen production while increasing breakdown. Research shows inflammation tips the balance from skin renewal toward degradation. Studies in the Journal of Investigative Dermatology demonstrate that reducing systemic and local inflammation slows visible skin aging. UV exposure, pollution, and metabolic dysfunction all contribute, but inflammation is the common thread connecting them. Those lines and dullness aren't just time passing, they're inflammation literally aging your largest organ from inside out. Next, symptom 9. Bloating, discomfort, or IBS-like flares. Unpredictable bloating and digestive issues may signal low-grade gut inflammation disrupting your digestive ecosystem. Research in gastroenterology journals establishes that chronic gut inflammation, often with dysbiosis, bacterial imbalance, disrupts the gut-brain axis and increases visceral pain sensitivity. This inflammatory state creates significant symptoms, affecting quality of life. Studies document that subtle inflammatory changes in gut lining alter intestinal permeability, allowing bacterial products to trigger immune responses and chronic immune activation, contributing to systemic inflammation. Research emphasizes that the gut contains approximately 70% of your immune system, making it critical where inflammation either stays contained or spreads systemically. Studies in Frontiers in Immunology link gut inflammation not just to digestive symptoms, but to accelerated aging throughout multiple body systems. Your bloating and discomfort might be warning signals that inflammatory processes are compromising this crucial barrier, potentially accelerating aging through mechanisms reaching far beyond digestion. Next, symptom 10, low mood, irritability, or loss of interest. Emotional flatness and disproportionate irritability have surprising connections to chronic inflammation. Multiple meta-analyses published in psychiatric journals document elevated pro-inflammatory markers in people experiencing depression. Studies consistently show higher C-reactive protein, interleukin-6, and tumor necrosis factor alpha levels in depressed individuals compared to healthy controls. Research published in Molecular Psychiatry suggests the relationship may be causal. Studies show inflammation induces depressive-like symptoms through effects on neurotransmitter metabolism, particularly serotonin and dopamine. Inflammatory molecules alter how your brain processes emotions, rewards, and motivation. Clinical trials published in Biological Psychiatry testing anti-inflammatory interventions showed moderate success alleviating depressive symptoms, providing additional evidence for this connection. Some researchers propose that a depression subset might be driven primarily by inflammatory processes rather than purely psychological factors. Chronic inflammation might be the hidden factor affecting brain chemistry and emotional well-being.
Next, symptom 11, muscle loss or new weakness. Progressive muscle loss and weakness, sarcopenia, accelerates with chronic inflammation. Research published in PMC journals establishes that pro-inflammatory cytokines, particularly interleukin-6, tumor necrosis factor alpha, and C-reactive protein, directly link to declines in both muscle mass and strength with aging. These inflammatory molecules don't just correlate, they actively promote muscle loss. Studies document that chronic inflammation accelerates muscle protein breakdown while impairing protein synthesis. Inflammatory cytokines interfere with growth factor signaling, impair satellite cell function needed for muscle repair, and promote insulin resistance in muscle tissue, creating a catabolic state. Research in the Journals of Gerontology tracking older adults longitudinally showed that those with higher inflammatory markers experienced faster muscle loss rates and greater functional decline over time. This inflammation-driven sarcopenia predicts falls, fractures, disability, and mortality. Weakness you're noticing might be inflammation actively breaking down muscle tissue. Next, symptom 12, reduced sexual function or libido. Declining interest and physical response involve more than hormones. Systemic inflammation and endothelial dysfunction play significant roles. Studies published in Nature and medical journals document clear associations between inflammatory markers and sexual dysfunction in both sexes. For men, chronic inflammation contributes to erectile dysfunction through blood vessel health effects. Inflammatory molecules damage delicate endothelial lining of blood vessels, impairing nitric oxide signaling essential for proper blood flow. For women, inflammation affects arousal, lubrication, and satisfaction through similar vascular mechanisms plus neurological and hormonal pathway effects. Research shows C-reactive protein and other inflammatory markers correlate with reduced sexual function across multiple dimensions. Sexual response requires healthy blood flow, proper nerve signaling, and balanced hormones, all systems vulnerable to inflammatory damage. Studies found that treating inflammation through lifestyle interventions or medical therapies can improve sexual function. These 12 symptoms reveal how chronic, low-grade inflammation silently accelerates aging throughout your body. From persistent fatigue and cognitive decline to bleeding gums and reduced sexual function, these seemingly unrelated signs share a common inflammatory root that research has thoroughly documented. The encouraging news is that many inflammatory processes respond to targeted interventions. Understanding these connections empowers you to address underlying inflammation rather than just managing isolated symptoms. If this video illuminated patterns in your health experience, please type "helpful" in the comments. That motivates us to produce more content like this. If you found value here, hit that like button, share with someone who needs this information, and subscribe for more research-backed health insights. Thank you for investing time in understanding your health. Knowledge is your first step toward taking control of how you age.